So where are we right now? We are seeing another rise in COVID cases across this country, but specifically here in Allegheny County. We are seeing our hospitals filled up again with COVID cases and people being really sick. And what we see is 75% of those patients that are in the hospitals and really sick are unvaccinated. And so vaccination is going to be our tool, our key to ensuring that our communities are safe. We still see disparities in COVID cases, COVID hospitalizations with our communities of color, and that's why we're out here today to answer any questions that may help you make that decision to get vaccinated or help you when you're talking to your friends and family. We know that we're coming up on this holiday season and everybody's going to be gathering together, and that is the greatest risk that we have is when you can get COVID, when you have those exposures, and we want to minimize the amount of exposure that everybody has against this disease.
And just to add to that, remember we just got out of Thanksgiving and we are seeing a big surge in the new cases because of people congregating, getting together and wanting to spend time with family. But whenever we spend time with family, we become more relaxed. And even though there are a lot of people that are vaccinated, there's some, like Dr. Conti said, that aren't, and they tend to, and you may not have any symptoms, but you can still pass this on to others. And the ones that are the most vulnerable are the ones that have health risks, health issues. And we are, like she said, the majority of people in the hospital are unvaccinated. And even though with the vaccine you can still catch the new variants, it minimizes the risk of going into the hospital or the complications that you would see with being unvaccinated.
So with that, any questions from anybody?
Dr. Conti or Dr. Francis, do you have any advice on how to gather safely during holidays?
So, you should be gathering with people that you know and who are friends with, and you should not hesitate to talk about vaccines and vaccine status. If you are going to gather with those that aren't vaccinated, I recommend that you wear masks, just like we are here today wearing masks. We know that eating is that highest time of transmission because people are talking and eating. That's when you have a lot of respiratory droplets that can occur. And so space out. Make sure you're not closely gathered together. That 3 feet of distance is good enough to help you. But then right after you finish eating, go ahead and put your mask back on. And you want to wash your hands. Either use hand sanitizer or washing your hands with warm soapy water for 20 seconds.
And don't forget that if you are going to be going somewhere where there are a lot of people, maybe you have the right to ask the question. If it's your house or if it's an elderly family member's house, you have the right to ask someone, to stop someone at the door. They're coming in and somebody's coughing or they have a kid that has some type of symptoms. You can stop them at the door and say, we'll see you next time, because safety is more important than just having somebody mad. They can be mad, but as long as we're all alive, we're good.
Right, and that's what this is really about, saving lives, right? And there should be no politeness when you're trying to save you and your family members' lives.
Did somebody talk about the new variant?
So anytime that there's a virus, viruses are living beings, right? The goal of a virus is to stay alive. And whenever, you have a lot of virus out there and it knows that it needs to stay alive, it's going to change itself to make sure that it stays alive. And that's what viruses are, right? The longer we have high viral loads, the more chance those viruses have in changing. Right now, the newest variant is Omicron. What we know about Omicron right now is that it is highly transmissible, which means it's easier to pass back and forth. It looks like from early stages it is less disease pathogenic, means it's not causing people to get as sick, but that just means more people are getting it because of Omicron is there. In our hospitalized patients, it's the Delta variant that we're seeing because that's the one that is very disease pathogenic, which means that it's making people sick.
So just to kind of piggyback piggyback off of what she said, remember, the more opportunities this virus, coronavirus, has to spread, the more opportunities it has to change, mutate. So the fact that we have a high viral load or high transmissible rate means that every time it moves from one person to the other, it's constantly copying itself. And with every copy, it has the opportunity to change some stuff so that it can survive. And so it kind of goes back to what we said before, that if we can decrease the amount of transmission from person to person by wearing our mask properly, but also by getting vaccinated, we decrease the chance of this thing moving from person to person and creating new variants, which even though Omicron is not as, it doesn't look like it's as severe as Delta, we may get another one that's worse than Delta, you know, and more highly transmissible than Omicron because it's really trying to survive.
Do you think this is our new way of life?
I think until we get this under control and we are educated and understand how serious this is, we will be wearing masks for a while. And we will be social distancing. We hope that we don't have to go back to the way we were originally, where we were everything was shut down, which, you know, it affects every aspect of our lives. A lot of people say they think, oh, it affects the economy, but it affects us mentally, socially, emotionally, all that stuff. So this virus didn't just attack our economics, it attacked our entire being, all of us, and the fact that we couldn't, our normal changed. But I think the most important thing is to pay attention to what the experts are saying. Most of the experts are the ones probably beyond us, the researchers, that they study this thing to the finest detail, and there's so much research out there, but their goal is to try to figure out how we can get past this. We've had epidemics, pandemics in the past, and those are the researchers are the ones that helped us to move from this point, from getting to having to wear masks, to being able to be out and not return to our normal, but have a new normal. We may have to continue to wear masks if we're in a large setting, but time is going to be the thing that's going to tell us if that's going to happen or not.
So the one other thing I want to just bring up, especially in the light of education, is if you choose not to get vaccinated and you are exposed to COVID, there are treatments out there. And so monoclonal antibodies are one of those treatments that is time sensitive though. You have to get in within a certain amount of days to be able to be eligible for that treatment. And so I recommend that if you get tested and you're positive, talk to your doctor about whether you're eligible for monoclonal antibodies. I know in our health system, everyone who's been treated with monoclonal antibodies, there has not been one death due to COVID for those who have been treated.
That reminds me, so the two treatments that are out from Merck and from Pfizer, are they being implemented in this area at this point or not yet?
I'm not aware that they are.
I just have one more question, sorry. Can you tell me, like, in this area, as far as race, what does the numbers look like of positivity and deaths and things like that? Do you have any input on that?
I didn't look at the latest numbers, but I know that our zip codes that have the lowest socioeconomic status, which tends in our area to equate to race, are where COVID is the highest. And so you could assume that, you know, our persons of color are having higher rates of COVID infectivity than other populations, which is why events like this is so important to get the information out that have vaccine available.
And don't forget, you can also reach out to your primary care doctor and go to events like this, like you did, asking questions, because there's a lot of misinformation out there, and that seems to spread far faster than the true information. But if you have questions, if you have concerns, then the time is now, the time, not waiting until you get sick to ask those questions. Ask them before. And remember, the vaccines work. So don't think that we're just trying to add another vaccine to your schedule or to your children's schedule. We are really trying to get in front of this virus so that we can get rid of it, so we can possibly get to the point where we are no longer having to social distance or even talk about wearing masks or anything.
And then, just so everybody's aware of who's eligible, anybody 5 years and up are eligible. And now even our 16 and 17-year-olds are eligible for the booster and should get boosted. And so if you are 5 to 15, you should get your 2 shots if you're getting Moderna or Pfizer, and 1 if you're getting J&J, although those younger groups aren't eligible for J&J. But starting at age 16, you do need those 3 shots to, at this point, be fully immunized.
Have they determined any long-term effects for COVID?
So that is being studied now, what they call our COVID long haulers, and there's a lot of research going around there. My father had COVID. He got it in the spring of 20, and he still has fatigue issues, and that's one of the things that we know. Chronic cough is another issue that we know for sure, but as this goes on, we continue to study COVID and what the effects are.
And remember, COVID affects everybody differently. Even those that have a lot of health issues can get a milder form of it. Like Dr. Conti said, my mom and dad both contracted COVID, ironically, from my 97-year-old uncle at his birthday party. They took off their masks just to eat, put it back on, and they all contracted COVID. He had actually gotten it from his son, who was not at the party. So, and my mom, her symptoms were, she had fatigue, she had headache, and fever. That was it. My dad had nothing, no symptoms. And if you look at his comorbidities or his health issues, he has more than she does. So it affects everybody differently. But at the same time, you have those that are supposedly young and healthy that are dying as well. So it's not about, it's like you're playing Russian roulette with your life when you don't take the necessary precautions to avoid catching this virus. Any other questions? What about in the back?
All right. Well, thank you for having us.